The goal was a company that you would stick with for 20 years. And so what is that opportunity? And that's the amazing thing about women's health and women's midlife health is that we have an opportunity to build a company that is your health partner for 20 plus years.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
When I first connected with Joanna Strober through the Rosenman Adapt program in 2023, I was immediately inspired by her resilience and unwavering commitment to transforming women's health. As the founder and CEO of MIDI Health, Joanna is not just an entrepreneur. She's a trailblazer who has navigated multiple careers with determination and vision. From her early days in venture capital to founding Kurbo Health, a digital therapeutic for childhood obesity that serves tens of thousands of adolescents worldwide before being acquired by Weight Watchers in 2018. And now leading MIDI Health, Joanna has consistently sought out meaningful ways to make a difference. MIDI Health was selected as a Rosenman Adapt finalist, joining prestigious Rosenman Institute cohort and further validating Joanna's innovative approach to women's midlife health. MIDI Health stands as the only holistic women's health platform for women in perimenopause and menopause covered by insurance, addressing critical gaps in hormone transition care. Her vision was driven by personal experience. After witnessing how her own hormone transition affected her sleep, energy, weight, and mood, and how effective treatment made a profound difference, Joanna was determined to make expert care for women at midlife both accessible and equitable. Joanna's journey is marked by her ability to pivot and adapt, turning challenges into opportunities. Her work with MIDI exemplifies her dedication to providing comprehensive midlife healthcare. In this episode, Joanna shares her unconventional career path, the lessons she's learned from each transition, and how her personal experiences shaped the creation of MIDI Health. She delves into the challenges of scaling a virtual healthcare for menopause platform, the importance of insurance coverage in digital health, and her vision for a future where women receive the comprehensive care they deserve. Her insights offer a roadmap for aspiring entrepreneurs in the healthcare space and underscore the impact of resilient leadership. And here's our conversation. Welcome, Joanna. Thanks for joining me today.
Thank you.
It's so nice to have you. I've been watching the progress that you made with MIDI. Congratulations for your accomplishment. One of the things I like to start is always with your journey, and you do have a lot of exciting and interesting path to take you where you are today. If you can tell us a little bit about how you choose this path and how the path laid right in front of you to take you where you are today.
Yeah, I don't think any path laid in front of me. It was definitely not a clear path, honestly. I went to college thinking I was going to be a lawyer, went to law school, worked for a year and a half as a lawyer, hated every minute of it. I was a really bad lawyer, really, really bad lawyer. This was actually in the .com era, so quite a while ago, and I really was interested in emerging internet and consumer internet. So I went and I was able to get a job at a venture capital firm. And when I was there, I made a bunch of investments in early internet companies like Baby Center and eToys and Blue Nile, companies that are still around today, actually. It's pretty exciting. I was fired in 2003 after the .com crash. So I had to scramble to find a job to feed my family, and I ended up working in I worked for a while in private equity, and then I worked in the fund-to-fund space where I was investing in buyout funds and venture funds. So I actually spent quite a long time doing that. I was not doing startups. I needed to, I had 3 kids. I needed to support my family. And then in 2014, I got an idea to start a company focusing on childhood obesity. And I got very excited about that. So I left my very stable job to go start that company. And that company had a lot of ups and downs, but we ended up selling it to Weight Watchers in a really successful outcome for my team. Worked there for a while and then left that to go start MIDI. So honestly, 5 different careers. I had no idea I would end up here.
And looking back, like I'm sure all those experiences have shaped who you are and in terms of help you through the process of starting MIDI. What are the most vivid memories that you feel like, wow, that is something that I remember that I should never do, or I should do that all the time?
Honestly, my biggest lesson is resiliency, quite honestly. And I think it's an overused term. But I joke that the people I admire the most in the words are like that old battery ad about the Energizer Bunny. And they say they just keep going and going and going. There are a lot of times that were really hard. And I don't think that it's clear. Sometimes I guess my other favorite saying that I actually use a lot with my team is when you're tired, rest, don't quit. And I think, I've had a long career, right? I'm not a young child. I've had a long career. I've had a lot of ups and I've had a lot of downs. And so I think resiliency to me really is about just kind of setting North Stars on where you want to go and just keep going toward that dream or going toward, the goal you're trying to get to.
And I think sometimes it's not easy to find that North Star right away. I felt like, especially when you're young, you're just like, okay, I go to college. Everybody goes to college. And then like, okay, I got to go find work. Everybody goes to work. But again, how do you make sure when you're down, get up again?
Well, also, I think one thing when I think about careers is there's definitely times to start a company. There's times to take a job where you are just making money to support your family. Like it's, do I regret those years at all that I was maybe in a less interesting job, but able to see my kids more? I think that was a great thing that I could do too. So, I think careers definitely have zigs and zags. And, for me, it was really just about finding something I like doing and then pursuing those things.
And tell me more about your journey with MIDI. How did it get started? Why MIDI? Why in that space?
We started Kerbo in 2014, and I learned the digital health industry then and really the goods and the bads of it. And that was before COVID, which is key to this discussion. So I saw that we really needed insurance coverage for a company to work. Like just building a cash pay company in digital health is really hard. And then the other thing is you need to have a really long LTV. I think one of the biggest problems with weight loss companies, and it's actually somewhat a problem, I guess, with dating companies, is that if you're successful, people are done and they don't need you anymore. It's kind of a funny thing, right? So I used to kind of joke with Kerbo that if our product worked really well, it was bad because then we were done with them. And so a lot of what I was thinking for my next business is it had to have a really big TAM, so a really big market, and a really long LTV. The goal was a company that you would stick with for 20 years. And so what is that opportunity? And that's the amazing thing about women's health and women's midlife health is that we have an opportunity to build a company that is your health partner for 20 plus years. And so really it was around, can I get insurance coverage for my next company? And then can I have a long relationship with that person?
So do you think your process was at that time, was like, okay, those are my 2 biggest criteria. And then you just scout around like, this is the area that I want to jump into because it fits that 2 criteria that you set yourself.
Well, so I think it was both that and the intersection of my own personal experience trying to get menopause care. I was suffering quite a bit from having menopause symptoms, and I had gone to many doctors to try to get some help. And each of them were specialists in their own area, but they weren't specialists in women's health. So none of them tied the everything together. And none of them said, okay, so you have these 5 symptoms. They are all actually related to your estrogen going down. We should think about estrogen. Instead, I had a sleep study because I wasn't sleeping and I was having some anxiety attacks. So they told me to go on an SSRI. Like there was no one who was looking at it from a holistic women's health perspective. Instead, it was like a head problem or like, and so I was having that at the same time. And so experiencing that. And then finally, I found a doctor in San Francisco who was amazing, but I had to drive to San Francisco, which is a long ways, and I had to pay $1,000 to get this. And so that was actually when the light bulb went out, because after 2 weeks, I was feeling better and I had my life back and I had my personality back. And I really wanted to make that type of care available to everyone. So it was that understanding of, I really want women to have access to this. And now with virtual availability, you can have insurance coverage to cover it. And I can take advantage of the fact that there's a big burnout for women in healthcare, and we can give them a really good place to work. So it was just a confluence of a bunch of different things that made this possible.
Mm-hmm. So tell us a little bit about MIDI and how does it work, and tell us more about who can benefit from MIDI.
Yeah, so MIDI is a holistic care platform focusing on women. Our primary audience is women 35 to 65. But honestly, we have women who are in their 20s coming, and we have women who are over 65 coming. So we really are a holistic women's health platform. And our goal is to take care of the various things that women need that don't require in-person care, which is a lot. Most care doesn't require in-person care. And where we have special expertise. And so our providers are specially trained in holistic women's healthcare. They understand that a lot of women's health issues are related to their hormones, and they're trained to think about you from that perspective. So maybe you have migraines. Is that related to your hormones? Can we test that? Maybe you have a weight issue. Well, actually, in midlife, women gain a lot of weight. That is actually related to their hormones. It is a hormonal issue. We can help you with hormones. We can help you with the GLP-1. We have a whole treasure trove of things that we can use to help you. But let's look at it from the perspective of being a woman. And so that's how we've designed our platform. And we have care in all 50 states, and the care is all covered by insurance. So we make, when we're getting more and more insurance contracts every day, that's, work in progress, but it's something that we're working on. And our goal is to essentially offer expert, high quality care to women for their issues. And then we're partnering with health systems. So when people need in-person care, we have a place to send them.
So for somebody like me who wants to use your platform, MIDI, do I usually still have my primary care, or then the MIDI person will be my primary care or OB-GYN?
So if you already have a primary care doctor, definitely stick with that primary care doctor. We're not trying to take away your primary care doctor. The truth is there's a huge shortage of primary care in this country. And so many of the women coming to us don't have a primary care doctor. So for those women, we can help them fulfill that. But we want to coordinate with your primary care doctor. We just are finding that often women don't have one.
Mm. And so how does it work? So now I have my health plan that cover MIDI, and I have my primary care. So say I'm at UCSF, and when I have issues, first thing I go is usually my primary care, and then the primary care will refer me to MIDI, or do I just go to MIDI right away and bypass?
Well, you don't need a referral unless you don't need a referral. So often what I'm seeing is women go to their primary care doctor once a year, and maybe that's where you have your pap smear, or they make sure you get your mammogram. A lot of women, 25% of the women coming to us haven't had a mammogram, haven't had a colonoscopy. So we're making sure they get those things done. Like a primary care doctor, because they don't have a primary care doctor who's doing this for them. If you have a primary care doctor that you really like, then that's great. Talk to them about hormones. And if they prescribe you hormones, that's great. Again, most doctors don't have that training. And so most women, I saw a very interesting statistic the other day. 85% of women have menopausal symptoms that significantly impact their life. 85%. We know that for most of those women, almost all of those women, hormone replacement therapy is the appropriate treatment. Guess what percent of women in this country are getting hormone replacement therapy? 3.8%. So 3.8% of the women in this country are on the appropriate treatment plan for the 85% of women who are seriously suffering from these symptoms. So that's the care gap, and that's the gap we're trying to fill.
And do you know why that? Is it because of the past? There's a lot of article back then. That's why a lot of women are afraid of the hormone therapy.
Yeah. So it's really sad about that study, which is misinterpreted and just incorrect. That study has been proven pretty much 100% failure. And I think many people believe it's one of the biggest mistakes made ever in women's health. The result is that for the past 20 years, no doctors had had training in medical school to understand hormones and to understand menopause. So doctors are not trained in this. It's not their fault. They didn't learn it. And so you go to them and you say, I have a family history of breast cancer. And they say, you can't take hormones. There's no evidence that someone with a family history of breast cancer can't take hormones. Zero. Actually, the estrogen-only arm of the study actually showed that women who took estrogen had a less high risk of, less likely to get breast cancer. So women have been really underserved. And what's very sad to me is they continue to be underserved because they continue to go to their primary care doctor and they tell their primary care doctor that they are not sleeping or that they're having anxiety and or they're having weight gain. And those doctors don't think of it starting from a hormone perspective. It's not holistic women's care. So that's just not the perspective that they're providing care in. So what women tell us is they're not heard, they're not paid attention to, they are trivialized. This is in part because doctors don't have time. And, the average primary care doctor visit is 6 minutes. But it is also because they're not trained to understand the symptoms and understand the treatments. So our job is to be the place that we have the expertise, we have the time. Our visits are 30 minutes, so we have the time to talk to you, understand your symptoms, understand the challenges that you're going through. And then we iterate. This is an iterative process. It is not a one-size-fits-all. And I think that's very important for women to understand. They come to us and they try a hormone and they say, it didn't work. I'm like, well, let's try another dose. Let's try something else. Our job is to iterate with you until you feel great, honestly. And it's not till you feel okay. It's till you feel great. That's our job. And we train our NPs to do that.
And now I'm thinking about segue to different areas. That you were in a part of you experienced the whole .com burst bubble, and the virtual. And there's a lot of talk about, during the COVID, the virtual take care of a lot of the things. And what lesson that you can draw from your .com bust to be successful in creating and sustaining a virtual care offering to the population?
The lesson from the .com bust and boom is that there were great ideas. A lot of them spent too much money and kind of flamed out, but some of them didn't and just turned into amazing, great companies. And I think that the same thing is going to happen with digital health, that a number of companies will flame out and won't be the right company. But I have a lot of confidence that we are just beginning the consumerization of healthcare and that consumer brands will be built during this time and that we'll see really big companies emerge that are focused on digital health. So I'm incredibly optimistic actually about where we are.
Where do you think that when you saw what made the company become established and great? Besides spending too much money, again, depending on, it's relative sometimes.
It's funny you say that, right? If you compare to the .com era, Pets.com was a total bust and Chewy is a complete win. So, it is not the case that some of those ideas were not great ideas. They were just perhaps too early. Maybe they grew too quickly. They didn't sustain themselves. But in a lot of those busts that you saw in the dot-com era, you saw almost the same company emerge and be massively successful. So, I've seen 3 downturns in my career as an investor. And the dot-com one is one, 2008 is another, the COVID time is another. In each of those times, amazing companies emerged. So I actually find that, yes, they're very painful for people. And, a lot of companies don't make it out of that. And it's not their fault necessarily, but it doesn't mean their ideas were not good. They just maybe had the wrong time. But the things that I see right now in the commercialization or e-commerceization of healthcare is that I think that the way the world is going to go long term is that you're going to have healthcare systems. They are going to be there for complex care and in-person services, and everything else will be done virtually. And now, for the first time, using MIDI, for example, we have our chief clinical officer is a professor at UCSF. She runs their survivorship clinic. She's run that for 30 years for women who have cancer, who also have menopause symptoms. You had a 9-month waiting list to get in to see her, and people had to fly across the country to see her, right? Now, on MIDI, you can see her or someone that she has trained in a few days. And you don't have to fly anywhere, and you can get that same really high quality care. So that is incredibly exciting to me. And the opportunity to say that we can take expertise and scale it across the country, scale that knowledge, scale access to these experts in healthcare is just wildly exciting to me. And so, our job is to talk to the sleep experts, to talk to the hormone experts, to talk to the anxiety experts, the brain health experts, and then take all of their great information, put it in our protocols, train our providers to do that, and then offer access to women to that great information. And that's just something you couldn't have done before. So, and it is very exciting.
I think definitely it's an exciting time with all the technology. I was talking to somebody that I think it's a great time right now to be a human being, as bad as the news make it sound. One of the things that, again, sometimes it's my perception, like I felt that as a woman, menopause oftentimes it's just like, again, talking about access, oftentimes the people who are under-resourced or underprivileged, they don't think about menopause, maybe because they don't know. It's just like, hey, most probably they would say, well, that's normal. Yeah, that's how we're getting old. And again, access, you're saying you want to get more access. How can we provide that access to more women who oftentimes don't know about? There's option when you go through a menopause. You don't have to suck it up and, I don't know, wait until you are 82 and I feel better again.
I mean, that's a lot of my job is to proselytize and to try to spread the word and to let people know that this is something that starts around 35. It is normal and it can be fixed. And so whether that's, it's our job at our company, it's the job of everyone to let people know that, a lot of women, for example, are very angry in their 40s and they don't know that's actually related to hormones. Or I feel like my job is to educate all therapists about painful sex in menopause and perimenopause. And women come into their marriage therapist and they're talking about sex or lack of a libido instead of saying, you should go talk to experts in women's health because maybe this is a hormonal issue that we can fix. And we've done that for men. We put billions of dollars into Viagra. We haven't even talked about it for women. It's just like a secret. So, just using that. And then honestly, every work environment should be talking about this because in a very large study, 50% of women said that their menopause symptoms had negatively impacted their careers and that they were not applying for raises and promotions because of their menopause symptoms. And 10% of women were leaving their jobs because of their menopause symptoms. So this is not innocuous. Like, this is not just something that we should tell women to grin and bear it. This is something that we should help them fix. And so part of what we're doing is also talk to employers and say to them, you need to tell your employees that they don't need to struggle and that they can get access to high quality care.
I mean, I like the idea of moving to make everybody feel better, because then you're happier, you're more functional. And I'm just trying to be a devil's advocate here, that women have gone through menopause for thousands of years. And it's almost, when you think about it, we don't think of menopause as a disease. So that's for, maybe you don't feel like you need to fix it. That's why when you have a migraine, that's the disease. And how do you change that mindset, thinking like, that's natural? Why do you have to fix something that's natural?
We don't tell men that ever.
Right.
Ever do we tell men that their penis is not working and that's natural. Okay? We don't tell them that on anything. So why do we tell that to women? I mean, seriously, it is not, when you are not feeling good, you deserve to feel better. You don't have to feel shitty and assume that it's natural. And there is a cultural issue there where women are being told it's just natural to feel shitty and you're like old, but they're not. And they do not deserve that. But that's not how doctors treat them. I could read you so many things on our Slack where the doctors just completely dismiss them.
Mm-hmm.
So, I mean, getting back to the hormone therapy, okay, women, when they age, they get frail, right? And we have this image in our head of frail older women. One of the reasons they get frail is their estrogen is going down, right? So if you start taking estrogen when you are young, you can keep your bones strong. Why is every doctor not telling that? Are we just assuming it's fine for women to turn frail? Like, there is a medication that absolutely will stop that. So it's that we as a society have accepted women's aging and women's pain in a way that is just inappropriate and I think really needs to be stopped. So that is, I feel really strongly about this. This is not, I mean, cancer is natural. We fight cancer, right? Heart disease is natural. Diabetes is natural. We fight all of those things. Why are we not doing that with women's health?
That's a good question. And often, I mean, I remember when I see my doctor for something, oh, that's just normal. That's part of aging.
That's just not true. It might be part of aging, but it's not okay. And it's not normal. It can be fixed. So I don't know. I would find out if they would tell a man the same thing.
Yeah. And I think it's oftentimes you do believe what your doctor tell you. And it's like, okay, there's nothing else you can do. And I think it takes oftentimes somebody else to, for me, I felt like I have some friend who I can talk to. I say, oh, no, that's, this, you can do X, Y, Z, and then you can push back. And that's usually, you get not better service, but I think sometimes being a squeaky wheel patient can get you a lot more than just that, okay, accepting it. Just like life, I guess, that you have to work hard.
So I was recently talking to someone who works at a large healthcare organization. And she was arguing, she wanted her organization to work with MIDI. And some of the older men who run the hospital said, we already provide menopause care. We don't need a partner with MIDI. And getting back to a number that I told you earlier, we know 85% of women suffer from menopause symptoms. We know the best solution for them is to be on hormone therapy. And unless you're in a very small class of women who can't be on hormone therapy, that's the best solution for the 85% of women who will benefit from it. So she went and looked. Guess what percent of the women in this age category in her hospital system are prescribed estrogen and progesterone?
0.
2.5%.
Which is the same as the population.
So of 85% of women who are suffering in that hospital system, 2.5% are being prescribed the right medication. It's really sad.
Well, I wish you luck on that one. I hope that, you have a lot of data to prove how it works, and hopefully more women can benefit from this. Last question. We talk about, like, for somebody who are new in the healthcare, who are really interested in solving the problem in healthcare through startups, what are any top 3 advice that you've received that you think that can be helpful? Besides, keep going like what is the battery name? the
Oh,
Energizer.
like the Energizer bunny. Do you remember those ads with the little bunny?
Yeah.
Right?
And keep going.
Exactly. Keep going and going and going. Exactly. So my advice is find big problems to solve. If you're trying to raise venture capital money, they really are only interested if you can find big problems to solve. And I think sometimes there are really good problems out there, but they're not big enough for venture funding. And so you should do it another way. I'm not saying you shouldn't do it, but it's hard if you can't find really big problems to raise the capital to do this. So I see a lot of companies that are very niche, and I love what they're doing, but it will be hard for them to raise money, just because the way venture capital is structured, and it's structured to achieve really large outcomes. So you have to start a company that has the right with the right funding, with the right outcome profile. I think that one thing that we did really well with MIDI is we used standard billing codes. That really helped us. It's very hard when you're doing non-standard billing codes, because then it just takes you a lot longer to prove to insurance companies that they should cover your services. So one big benefit we had was starting with the standard billing codes. And then I would say, I've had a lot of companies recently come to me and trying to sell to employers or through employers. I would try to go around that and try not to have to follow that as a business model. I think that employers are just overwhelmed with the number of things that they need, and they really are focused on cost savings more than anything else. So if you have something that can save them huge amounts of money, then they might be interested. But unless you have that, I would figure out a different business model and not try to go through employers.
Mm-hmm. Well, that's good advice. From that advice, you're talking about sometimes being a niche. And oftentimes I see companies doing a niche. And like when your resources is sometimes small, you start with a smaller space and then grow there. And oftentimes my question is, how do you tell that story? Because you always have to start with something small because you don't have that resource yet. And I think oftentimes I see is more how to tell that vision in a way that make you believable that you are going to achieve that bigger vision, but you have to start small, because everybody would say that, but then everybody don't believe it.
Yeah. No, it's a really good point. When we started, actually, we thought we were just a hormone company. Like we really talked about perimenopause and menopause and giving women access to hormones. That was really our initial business. What happened is we started serving women and finding out that their needs were much broader than we originally designed for. And we really had to go back and redesign everything to serve a much broader audience and many more needs. So I think part of it is building a platform that's extensible so that you can start and do a really good job in something, but build so you can be much bigger. And so what we did was we really built a system that we could very easily add new types of concerns to. So when women come and they said, oh, I'm having migraines and they're related to my hormones, we could launch migraines, right? When they said they're having issues related to weight, we could launch weight. Like we built a very extensible platform. So even though we were starting in this area, we have the opportunity to go out and go much more horizontal. And I think that is a lot of why we were able to raise the capital that we did, because we could show that we could build this into a very large company.
And so you mentioned earlier, when you started more like the hormone therapy kind of company serving that. And then is it by luck or by design from the beginning that, hey, is this something that I can grow horizontally?
It was by design that we built an extensible platform. It is by, I don't know if luck is the right word. We have tapped into a much bigger audience than we knew existed. So if you look at the statistics in the United States, half of counties don't have an OBGYN. There's a massive shortage of primary care doctors. And you add that on to the fact of how few doctors are trained in perimenopause and menopause. We just found that there's a huge demand for what we're offering. I think we kind of knew that, but we weren't thinking as broadly when we got started as we are now. So that's really the big difference, is that now we are thinking much broader and we can build a much bigger company than we actually ever thought we could when we got started. now that we see why women are coming to us and what they're looking for.
Yeah. And last question, I promise you, is so in the beginning, when you feel like when you started, it was kind of smaller than what it is now, yet you raise that funding, right? Because you're saying that it's hard to, but that even that small niche has to be big enough. Is that what you're saying?
Yeah. Yes. Yeah.
Okay.
The small niche has to be big enough, or you're going to raise a little bit of money, but you're not going to get enough money to make it big. And then it's a hard place to be.
Yeah. Okay. Okay. Well, that's great. Well, thank you for sharing your insight, your lesson, and your, I can tell that you're very passionate about solving the problem that women have in their health. And so wish you the best and keep looking forward to all the amazing progress that you're making. And
thank you.
So I hope
Thank
those
you.
85% women will get what they need instead of just 3%.
Yeah, exactly. It's a big opportunity.
Thank you. Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.